Real people, real stories. I'm writing to you today because with all my copays and every 7 months a medical marijuana doctor visit for $100, just for me to tell him my 45-year depression and anxiety are still full blown, I need help paying for my medical marijuana, which works better than any oxycodone or morphine. Can you please help me? Thank you. Hello, I was diagnosed with cancer last February, and I begun my second round of chemo yesterday. I also received my SSDI rejection letter yesterday. I have an income of only $400 per month from the state disability program. I was hoping that you might be able to find me an organization that could help me acquire cannabis, at least for the duration of my current chemo treatment. Thank you for your time. Hello, I'm a single father diagnosed with major depression and battled issues with anxiety and alcohol. I'm finally starting to get on my feet and I have a good job. However, for those who truly use cannabis for medical purposes, it can become quite pricey, and it takes a significant portion of my pay to cover just my medications and doctor's appointments, including my other meds that I'm prescribed for depression. If any assistance would be available, it would be a blessing and so greatly appreciated. Cannabis has been a life changer in allowing me to get my head clear in managing anxiety and debilitating depression. Hi, I have stage 4 breast cancer and recently lost my job. Medical marijuana gives me an appetite since chemotherapy makes me so ill, and it makes me happier during this heavy time in my life. It allows me to relax and go enjoy activities other than sleeping. And unfortunately, my insurance does not cover natural medicine, which has helped me the most, I believe. Please help. These are only 4 of the email requests for help out of the 78 I have received at Leaf 411 in the last 4 months. Unfortunately, I would need hours to share the thousands of requests we have received in the last 5 years since we started operating. People from all demographics have reached out to us desperately seeking assistance in affording their cannabis medicine. Hello, I am Katherine Golden, the CEO, Executive Director, and founder of the nonprofit leaf411.org. My presentation today is Expanding Health Equity with Medical Cannabis, Introducing the Framework for Insurance Coverage. I'm a fierce advocate for health equity in the cannabis space, and I'm determined to make a meaningful impact. So let's first talk about what is health equity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. Achieving this requires ongoing efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and health care. Let's look at the numbers and see what these numbers tell us. In 2023, 24.5 million people of all ages were uninsured. This shows that people are underserved and not provided enough help, products, or services to achieve their highest level of health. But this year, a historic 21.3 million people selected affordable health insurance. Thanks to affordable health insurance, millions more Americans have gained health coverage without limits. Now, even more people have access to essential health benefits. But what about if they want to include medical cannabis, like the cancer patient who said natural medicine is not covered by insurance? Our communities strive for optimal health, and as cannabis nurses, we are aware that medical cannabis can be a safer alternative to certain prescribed pharmaceuticals. The question is, how can we make medical cannabis available to those who want to incorporate it into their health regimen and have it covered by health insurance? What steps can we take to make this a reality? One solution was started at the Colorado Department of Labor and Employment's Workers' Compensation Division. The Alternative Pain Management Program was created. Its goal is to expand treatment options by creating a model to safely provide medical cannabis in the Colorado Workers' Compensation System. Now, eligible participants will be offered medical cannabis as an alternative option for pain management. The goals for this program, set by the department, were to increase treatment options and accessibility, improve patients' pain and quality of life, improve safety through physician guidance on medical cannabis. Now, this has changed to clinical team guidance instead of physician guidance, and I'll tell you why in a bit. And most of all, reduce opioid use. For this new alternative pain management program, they focused on enhancing patient care with these goals in mind, all of these goals in mind. But let's highlight just a couple of these critical goals. It had to be safe. The department knew medical cannabis was safer alternative to opioids. The state sought a high-profile local cannabis MD who guided them on the safety of cannabis medicine. It had to be patient-centered. It was impressive to hear a State Department say from day one that its main concern was improving patient care. They were struggling with patients who were opioid dependent for years and showing deteriorating health. They wanted to bring something new to the table as an alternative. And it had to be equitable. The department implemented a system that would pay the patient for their first time appointment to come in for an evaluation. After that assessment appointment, the patient would be reimbursed a sum to cover their time, regardless if they were accepted in the program or not. They didn't want to exclude a patient from the program simply because the patient didn't have the funds to purchase the first round of medical cannabis. Typically, a patient must purchase something and then submit a receipt for reimbursement. This would inevitably exclude anyone who couldn't afford that first purchase. So now this gave every patient a sum of money they could use to make their first dispensary purchase if they chose to. And this was the equity piece they wanted to provide. And I thought this was genius. So where does the nurse come in? The State Department knew how to collect receipts and reimburse a patient, but didn't know how to build the final part of the framework that involved patient care with medical cannabis. So this is where I came in. The state sought a clinician to help them finish building the regulatory framework. But wait, remember I said they already consulted with the local cannabis MD? Since an MD isn't involved in the back office or day-to-day care of getting a patient from point A to B to C, he had no guidance for them. They tried working with another clinical team who said, okay, department, you build the framework and we'll just do the patient care. But this wasn't what they needed. A final team said, pay us a ton of money to build a company and we'll try to figure this out. They said they were so disheartened by the obvious focus on the financial gain from every previous executive level offer that they searched LinkedIn for a cannabis experience case manager or care coordinator, since those are the titles of the nursing they are accustomed to. They needed someone to come in and put all the pieces together for them. They knew they needed a nurse. They searched LinkedIn and history was made. During my first meeting with the State Department, I wanted to give them a general view of all steps needed for patient care. I was so excited that medical cannabis was going to be brought into the traditional healthcare setting that I didn't focus on compensation at all. I was more focused on providing them a picture of how I would set up this framework. They called our first meetings a fire hose of information, and within a few meetings offered me a consulting position with the state. The State Department had zero experience in the cannabis space. With my extensive experience in the cannabis industry and having successfully built a cannabis business, I was confident in my ability to guide the department through the initial steps of building the regulatory framework. Some of the areas I was able to provide valuable insights included state regulations surrounding dispensary purchases, what a typical visit to a recommending practitioner would encompass for the patient, what costs does the department need to cover, like a medical card, transportation to the doctor's office, compensation for their drive to and from the dispensary? As nurses, we can detail how to provide exemplary patient care. Nurses know typical patient care and how to get the patient, like I said before, from point A to B to C. We are experts in patient bedside communication. As a nurse on the team, I built the cadence of contact with the patient. We know how to facilitate getting the patient to the doctor's appointments. As a nurse, I knew to ask the right questions about how the patient conducts activities of daily life. Do they drive? Do they don't? Do they take the bus? With experience working in all facets of the industry, a cannabis nurse can design the steps to get the patient to the dispensary and purchase the correct medicine. Why a cannabis nurse care coordinator? After working together, the team soon realized the importance of the nurse role because I was the first clinician who gave them every step of the patient process. For insurance companies to compensate a nurse, you must have a taxonomy code registered with Medicare or Medicaid. All types of nursing specialties are listed, but of course, not cannabis just yet. We landed on nurse case manager, care coordinator. This was their world of titles. and what they felt comfortable with. So I said, great, let's do that. However, I ensured that every time I signed something or created a form, I referred to myself as the Cannabis Nurse Care Coordinator. I mention this to highlight my experience with not forcing a traditional healthcare setting to change labeling immediately to everything cannabis, but instead use repetition to make it become familiar to them. For example, in the very beginning, the State Department kept calling the medicine marijuana or weed, and me a pot nurse when they introduced me to others. I never got angry or instantly corrected them. I just smiled and kept saying the word cannabis at every turn. And now, on their own, that's how they address this medicine and my title. As cannabis nurses, we are uniquely equipped with the resources and field experience to construct a patient-centered framework, placing the individual's needs and well-being above all. I requested to include hemp products in the reimbursement allowance so the practitioners would be able to choose a wide array of cannabinoids suitable for pain reduction if our local dispensaries didn't carry enough of a selection. My vision was to use dispensary as a pharmacy for the THC products and supplement the necessary acidic or minor cannabinoids typically not found in abundance in the dispensary, but online through quality products. I created the patient workflow from beginning to end, which included all the forms, consents, and surveys requested by the department. I coordinated care with all parties. This included the patient, the cannabis MD, the patient's workers' compensation attending treating physician, the State Department, and the insurer. Here's where the department changed its language from being a program guided by physicians to guided by a clinical team. As a current experienced cannabis nurse, I showed them that I had more knowledge than the MD who started the program because he stopped self-educating years ago. As the nurse, I provided education with purchase and safe consumption. As part of my role, I introduced the innovative Tetragram app to monitor compliance. This advanced technology allows the nurse to submit digital receipts on behalf of the patient, enabling immediate reimbursement. This is a significant leap from the traditional snail mail system still in use, demonstrating our commitment to leveraging technology for enhanced patient care. Nurses are becoming entrepreneurs more than ever before. They are successfully launching new businesses and managing companies. Our expertise lies in scaling healthcare services rapidly and efficiently. We know how to recruit other cannabis nurse care coordinators. We know how to recruit patient-focused cannabis NPs and MD offices. We provide ideas on how to run programs efficiently and at lower costs. I'd like to share this workplace lawsuit showing the difference when providing insurance-covered medical cannabis as an alternative pain management option. In 2004, a construction worker suffered a work-related ankle injury. Over the next 15 years, his workers' compensation attending treating physician used various techniques to manage the pain as his ankle slowly deteriorated. Eventually, he was enrolled in Minnesota's medical cannabis research program to address the pain. The dosage was increased over time to help him manage the pain from increased activities, which included returning to full-time work. He further explained that medical cannabis had provided him substantial relief by taking away the pain during the day and helping him sleep at night. He also testified that medical cannabis has helped him maintain employment and has improved his relationships with his family. I'd like to leave you with my favorite quote from Jane Goodall. What you do makes a difference, and you have to decide what kind of difference you want to make. Since my employment with the Workers' Compensation Division, I'm proud to say that they saw the incredible value a nurse could be for the department and hired their first ever nurse practitioner for their workplace injury care. I am no different from you. One of you, any of you, can do everything I have done. I don't have a master's or even a bachelor's, but what I have done is worked my butt off the last 7 years of my 27 years being a registered nurse, learning every facet of the industry as a cannabis RN. You too can show your state departments or healthcare facilities that a cannabis nurse can help them build the framework to incorporate cannabis medicine as an alternative treatment option. I'm on a mission to expand health equity for all patient populations utilizing medical cannabis. I firmly believe that all patients should have the right to choose medical cannabis as part of their symptom management plan. Please join me in advocating for this important cause. As cannabis nurses, we can make a real difference in the lives of those who need it most. Thank you.